and just create this flexion, right? So I'm here like this, and I'm kind of giving them instructions to almost slump a little bit. I'm going to pick a segment. We're going to kind of work through a segment here, and again, remember we've kind of done our motion assessment already, and let's just pick a segment right here. I'm going to put my thenar eminence right over him. I'm going to sit up nice and straight for me. There you go. And I'm going to start here, and then nice and easy, go ahead and come forward, and then in that position, I'm just applying that force. There's nothing fancy about this, and it really feels exactly like what it feels like when the patient is prone. I'm just pushing into a structure that doesn't have a lot of motion, and I'm applying that force. Now I'm not down here, I'm kind of like, as he goes, my forearm is kind of going with him, and I'm just going to kind of follow that. So I'm on the spinous process. I could pop off to the side. A lot of times I'll try to get a skin lock. So skin lock, see that right there? Like, I can't keep going. I'm reaching a skin lock. Even through his shirt, there's a point at which I have a skin lock in here, and that's the point that I'm going to kind of apply that force. So I'm doing the same thing as in prone. I'm just biasing him toward flexion. There's not big, large motions. I can't control that motion very well, to be honest with you. I mean, I feel like if we went any further, he would start to fall off the table. So we're kind of, I can maybe go down to about T9 maybe or so with that. Lower segments are going to be a little harder. Okay, so that's flexion. Extension, just forearms on your head, or forehead on your arms. Good. And then bring them a little closer together. Almost kind of like grab your, yeah, there you go. And make sure your forehead stays on your arms. Yeah, that's good. Perfect. Let me have you come down in the chair for me. So what I'm going to do here is I'm in the straddle position kind of like this. And I have his arms and his head. And what I'm going to do is I'm going to think about kind of elongating him, right? And then with this hand, I'm going to provide that fulcrum. So at the end, I'm going to kind of go boom, like that, like fulcrum into extension. Okay? So go ahead and do that again. Hold your elbows. There you go. Make sure you keep your forehead on your arms. Or like this. There you go. Okay. And so we're here like this. So just tell them to relax. Trust me. It's always scary. So I'm in here like this, and then I'm just doing that and back. And see, I'm kind of scooping, and then right here, a little extra end range over pressure. Right? A lot of times I'll come off to the right, and check this out. So I might come off to the right, and now, do you see how I'm bringing him toward me? Right? So I'm creating a little bit of kind of like an up opening maybe on that right side. So I'm here, but then I'm kind of going, all right, ooh, right there is tight, okay, a little bit right there, and then back again. And patients will like this. They'll kind of say, oh man, it just feels like I need that, It just kind of opens things up. I could side bend them away a little bit and just go on this side. So, I'll kind of just play with general areas here. I'm not thinking, man, I got to just work that segment. These are all often techniques where I'm hitting a section, and I'm just trying to kind of work through that section, getting things moving. So this works better lower, so that you can kind of get that leverage. And then the last one, rotation, go ahead and sit back up on the table for me, please. Is arms across your chest again. And now this one is the best one because I have the most control here. Right? I mean, I can really control this motion really well. So I'm moving him through motions. I've already assessed, the amount of motion. So let's work this area, let's say. So I'm going to kind of come right off the side here. I have my thumb on the transverse process on the right. Okay? And now what I'm going to do is I'm going to create rotation, and then at end range, I'm just going to provide a little bit extra, like that. Somebody, Cody's size here, I might use more my hand. So we kind of come around like this, and now I'm just using that whole hand. You might say, well, you're getting 5, 6, 7. Yeah, that's okay, because they all need to move. In fact, I'm going to go to 6 now. You know what I mean? So I'm at end range, and I'm oscillating, and I'm kind of, both hands are moving like this in one direction. And I can immediately go into rotation to the right. Same kind of deal. In that case, I was just pushing on his rib a little bit. Remember we said how we can use the ribs to mobilize sometimes? If his ribs are stable and the CV joints and everything are in good shape, man, I got great leverage. If I use that rib, I can even produce greater rotation at that thoracic vertebrae. So that's not a rule that I can't break. I can go through that joint if I need to. Remember we mobilized the hip and we went through the knee and the ankle? Or the knee at least? It's okay to go through other joints as long as those joints are stable. If they're what we call dirty, if they're dirty joints, like they're not clean, they're not in place, they're irritated and inflamed, we wouldn't do that. We'd want to be a little more specific, but a lot of times I'll use the leverage of that rib because I know about that intimate connection of those CT and CV joints, and I can really use that rib to allow me to really get a rotation at that segment. Okay? So not a lot of deep cognition going on, okay? What's happening is I'm identifying areas of tightness, and it's usually not the area that the patient came in with. This might be a cervical patient or a low back patient. And I'm simply addressing the region after assessing its motion. I'm just trying to get some stuff moving. I'm trying to get the junk out of there. That's what I'm trying to do. I'm not thinking as much, like with cervical, about pointing toward the eye and pointing. It's not as specific as that, in my opinion. We can pretend we are. I don't feel comfortable in trying to teach you that. So we're going to kind of go with really just addressing these restrictions, and then you retest and see if that motion is better, if there's less pain.